This bill puts us at stage 8 of genocide. It puts my husband on a registry. It limits the care that a nurse practitioner to give to already existing patients. It doesn't just talk about children, it talks about adults. We're going to come back to the children in just a second. Instead of my husband visiting his doctor regularly once every 6 months, he will now have to go in once every 10 days. Can you afford $100 and something visit every time you have to visit your doctor? No. Do you have to take certain medications at home? Sure. Do you have to go visit your doctor every time you take those medications? Okay, so let's go back to talking about the children. It takes away any type of therapy for the children. That means conversations with doctors, with other people about whether or not that child could have those feelings are not allowed to be talked. So you're exactly right. If somebody regrets not doing or doing something, how are they ever going to seek help in Florida if this bill is written? I don't understand why you're continuing to spread your opinion of what's going on if you haven't already talked about what's in place. The very minimal instances where you're talking about where children have had regret after transition, those are so small that no, I'm not trying to talk about those instances in this bill right now, because there are way more children right now that are going to unalive themselves because they cannot even talk to their therapists. Not to mention the children that have loving parents that will be stripped from them because your opinion you think matters more than doctors. There are doctors. My own doctor is crying and screaming for this not to happen. Do not let this continue. And all you would rather do is talk about small amount of surgeries that have gone wrong. You could have found another page to do that on, but you continue to point out how you're not being a jerk to me right now. And I get that you want someone to educate you on this, but again, you are only trying to use your voice. You're not trying to use your ears. I don't need to listen to your opinions or your research. I have talked to doctors and therapists about this. I get that you have some numbers and you have some concerns. That's great. We should be talking to those doctors and those medical people and ask them at what points were they following procedures and weren't. Do we even know that those things that they did were under full procedure? Do we know that all of the information that you have is specifically people who regret it because they regret the surgery? Because there are tons of people that regret doing it because society won't accept them. So they would rather just go back to normal. Please tell me why pointing out all these things while I'm going through one of the hardest times in my life dealing with this specific bill, why on my post you think it's okay to just do this? I'm leaving your comments because they help boost my post. Thank you.